Thank you, Mr. Chairman. Mr. Secretary, good to see you. David, good to see you.
Thank you. Nice to see you.
First, let me start with, during the governor's budget address, he said this, quote, "No, this crisis is not about politics at all. This is about math. Pennsylvania now faces a $2 billion budget deficit," end quote. What in your budget will actually reduce the structural deficit moving forward?
So there are several initiatives. It's a very good question. There are several initiatives that we have planned for this year that will help us contain the cost of growth. So a lot of times when you're talking about health care and what we do is largely health care for low-income folks, that is you're talking about the rate of growth. So bending the cost curve and also saving money. So there are several things that we're doing. First one is community health choices. That is about serving folks in the community where they can be. That costs anywhere from serving someone versus serving someone in a nursing home. That can be anywhere from 2 to 3 times the cost of serving someone in the community. It's also where they want to be. We also have in an interesting way, the opioid initiative we're talking about also has potential to help us save money in the long run. And I think maybe not so much in the department, but if we don't provide services for folks and help them beat their addiction, they cost us more when they show up in emergency rooms, or the impact they can have in family members and the family finances if they were to succumb to an overdose. But also folks that if we don't serve them in the community, they wind up being served in prison, and it costs a whole lot more for Secretary Wetzel to serve them in a prison than it does for me to serve them in the community. In addition, we're making investments in early childhood education and home visiting. Every study has shown that for every dollar you invest in those programs, you see a return that's sometimes $7 or above for each dollar that you spend. And I think for us that ultimately, over the life of a child, that could save you $20,000 for each child that you're able to serve through those programs. So those initiatives will help us contain costs. So when you're looking at our budget, it's important to understand is the folks that we serve are eligible for a whole bunch of programs. So take folks who are eligible for long-term supports and services. As Pennsylvania gets older, and the demographics of the state are that we're serving more people, and more people are going to be required to have those services. The question for us is, how are we going to serve them? Are we going to serve them in a system that's broken, one that costs twice as much, or are we going to make the investment we need to up front so that we can reduce those costs, and when we serve those folks, that we're serving them in the best way that we can, and also in a way that's cost efficient?
So all those programs annualized will not reduce the structural deficit. Annualized, what's that cost increase for next year carry forward?
So when you say reduce the structural deficit, I'm not sure that.
Well, there's $2 billion between revenues and expenditures. $2 billion.
You know, I'm sure
Total.
you're not saying that the Department of Human Services will fix the entire structural deficit.
Absolutely not.
Okay.
But if his entire budget speech was about structural deficits, there wasn't anything else in there. We read it 3 times. So if the governor's main goal is to not have a structural deficit, I assume the direction of all the departments is get me budget documents where we do not have a structural deficit anymore. So, there should be a lot of subtractions, not additions, to deal with that.
So I think perhaps it'd be a good thing to look at our budget overall when you're asking that question. So if you look at our budget overall, right, there are several things that have driven costs in my budget. I can't speak as authoritatively on the entire
There's
budget.
Federal mandates, believe me. I
know. So,
yeah.
but you asked a question, so probably let me answer it, right? Is that at the end of the day is there are one-time revenues that we have, and those are things that everybody here agreed to. General Assembly, the administration. There's probably about, in my budget, the increase when you're looking at my budget, it's probably about $250 million in one-time revenues. At the same time, right, there are initiatives. The initiatives I mentioned there, those are investments we're going to have to make to not have the budget grow even faster than it's growing now. If you subtract all those things out, our budget grows by about 4.5%, right? And if you look at that, compare that to the cost of healthcare growth in this country, the average growth for healthcare is about 6.6%. So when you're looking at that growth over time, right, Pennsylvania has actually managed to control its costs far lower than what the average cost for healthcare growth is across the country. Now, what you're getting to is that structural deficit is beyond all of that. How are we going to make our budget balance? And when the governor says it's about math, he's right. Because even if you look at that, if you look at the unprecedented savings we have from program integrity, the changes that we're making to reduce the growth of our healthcare costs, all the go time initiatives, all those things, that doesn't resolve the structural imbalance. And I think the governor has been very honest about that, is you're going to need to look at the revenue side. That's what having a structural balance.
Well, here's the problem with the go time initiatives. We've gotten all these documents of go time initiatives, and they're nowhere in the budget books. Like, if we're saving money, shouldn't they be subtracted out of certain line items? Like, we don't need those funds in there anymore moving forward, correct?
I believe that at least that there's a list of go time initiatives and what those savings are have been requested and provided.
Yeah, so there's savings. Is that matched in your budget documents anywhere? I'm probably one of the only people here that actually reads the governor's budget book, line by line. I did not see one single go time initiative, subtraction, and explanation of what it is in that entire book. There's an entire section in the front part that says go time initiatives, we're going to save money, yay us. But within the budget documents itself, it's non-existent. I mean, we get spreadsheets here, but where's it at within the line items of the budget?
I think when you look at a budget, again, I can't speak about other departments, but I know for our budget, a lot of the savings that we're talking about are included in the general cost to carry our budget and the overall amount. So, you know, you can get into certain line items, and some of them are very big. The savings that we've talked about and the things that were mentioned there, they might not be called out in a specific line item, but they're assumed in the growth and, or the growth or the lack of growth of some of those line items. So we can certainly go through we can provide you with the details of our go time initiatives, some of our other savings initiatives, and point to the areas where it would save us money. But I don't know that.
And when I say that's not only this administration, the Corbett administration, the Ridge administration, Rendell administration had those similar programs. You were here, and those administrations also didn't highlight those costs within their budget documents at all. Hopefully that change is made moving forward. And again, I think that's a budget secretary objective to do that.
There are a lot of accountants who would be very happy to have that conversation with.
So counties are handing back state dollars. They have seen savings through the Medicaid expansion, since people they have served are now obviously on Medicaid. So what's the reason for increasing their funding at this point, if in fact they're returning money? It seems like they're prudently spending money, and a lot of their costs have shifted to the federal government, much like the state's costs have shifted for the federal government. I mean, that's the point of Medicaid expansion for states. It was a good deal because we could shift costs to the federal government. So why are we giving them increases?
So I think that I almost agree with what you said there, but I think when folks looked at the Affordable Care Act and the ability, very close, very close. I think that when you look at the need that's out there, and I think there was some expectation that as you move some of the costs of the federal government that you would see savings there, but I think also when the piece that was incomplete from what you said was the need that was out there, and I think the need has grown so much that a lot of the funds that have been covered by federal government, we've saved, you know, we've shifted over $500 million in costs to the federal government on that. There is still a need out there, and that's when you say things like, you look at the block grant cut. I think if there are folks who represent counties here or folks who represent folks who are served by counties, I would be very surprised if any one of them tells you that there isn't a greater need than they can serve there. So I think when you look at those savings have enabled us to provide a higher level of service for the need that's out there. But I don't think it's you take that money and you don't spend it somewhere else. I think if you ask anybody in this room, any county administrator, they will tell you that the need is greater than it ever has been.
But if the need's greater, then why are they handing back dollars to begin with, especially within the block grant system? And they can keep 3% of unspent. So if they can keep 3% of unspent dollars and they're handing money back, how does that drive at need? Wouldn't they expend those dollars if they have a need?
So I think that I think you're probably getting to accounting issues. At any given moment, they're spending money on programs, and there are some programs that they might not spend it at exactly that moment when the fiscal year ends. There's money that carries over. There's money that they can use to invest to reduce their future costs. But ultimately, the amount of money that counties return as a part of the budget problem that the governor is talking about, the budget problem that I face in my department, that money is nowhere near what's needed to cover that. Now, I'm
not talking about covering expenses. expenditures. I'm saying they're not expending their dollars. So if they're not spending all their dollars and we want to give them more dollars.
I think what I'm saying is they are expending those dollars. I think in some cases.
Why are they handing it back?
I'm desperately trying to answer your question, Representative.
I mean,
let me
it's
get more than one sentence out in a row. I
Yeah.
might be able to do it. Right? Is at the end of the day, is you know as well as I do that the fiscal year can end at a certain point, and there are bills that are still due, and those payments may not have been made. Some of that is simply the transition between one year to another. And what I'm saying to you is that in any business, whether it's private sector, public sector, you're always going to have those issues. You know that, and I know that. Right? So that need is there, and whether they spend it on June 30th or July 1st, that's there. At the same time, the block grant was designed to give counties the ability to innovate. And when they innovate and they're able to save that money, I think part of the deal for the block grant was being able to invest that money, that 3%, invest that money back in innovation. So I think when you're looking at those things, certainly as we're trying to come to a budget agreement, there is room to look at some of those overage. But there's not, first, this we should be absolutely clear of. It's nowhere near the amount of money that we need to fully fund social services. And second, I would say that when you look at that, I think you also need to, as we are proposing investments to help drive down those costs, you need to give the counties the opportunity to do that as well. Otherwise, we'll be having the same conversation year after year after year.
What were the total savings for counties because of Medicaid expansion? Have you tracked that? I did ask Secretary Tennis because he went into great detail about the Medicaid coverage for drug and alcohol. What are those savings for counties?
Well, I think we've talked about
What's the shift?
But overall for Pennsylvania, we've saved over $500 million. The number is probably higher. These are for those folks. We can get you the exact number now, but that number continues to grow for folks who would have been served under our current laws, our current programs, our current eligibility, who are now being covered by the Affordable Care.
Can you give me the specific programs, the savings, and the number of people who were shifted over?
You will have any information that I have, sir.
Appreciate it. Obviously, with Medicaid expansion, we will see a reduction in federal funding. How is your administration, the governor, planning on covering that hole moving forward?
So that is something that's assumed in our budget this year. You're referring to the match rate that we have. So it started off at 100%. It's making its way down to 95%. That number is included in our cost to carry budget. And overall, when you look at the $500 million plus we saved by making the switch, the additional costs we have, we are still way ahead of what it cost us without the Medicaid expansion.
So part of the governor's tax increase is to pay for that cost shift.
No, I think that the amount of revenues we would need to run the government would be much higher if we didn't have the Medicaid expansion.
The Commonwealth Court in Knoll v. White held that state officials are mandated by the Supremacy Clause of the U.S. Constitution to continue paying states welfare payments during a budget impasse that rely heavily on federal funds. The court determined that the following specific programs had to be paid even with no budget in place: aid to families with dependent children, refugee cash assistance, food stamps, medical assistance. The court also upheld that state-only funded assistance programs that are operationally integrated with federal programs by means of intertwined computer programs and a single unified database must also continue to be paid if the state programs could not be separated out from the federal programs. Those programs specifically ordered that the court to be paid under this category were general assistance and state blind pensions. Can you tell me which HHS programs continue to be paid during the budget impasse due to the federal funding component?
So I think there are components of the Medicaid program, SNAP program, and TANF. Those are those federal dollars or federal pass-throughs. A complete list I don't have off the top of my head, but those are generally.
All right. Could you get us a complete list?
Sure.
Are any state-only funded programs currently operationally integrated with federal programs by intertwined computer programs and single unified databases?
I would suspect yes, there are.
All right. If so, I assume by your question you don't know specifically which ones. Could you provide us a list of which ones are intertwined?
I could probably think of a couple of them, but I'll be happy to provide you a list.
Has the department considered separating state-only funded programs from its operational systems and databases that include programs receiving federal funds?
No.
Were there any programs paid during the budget impasse that did not meet or comply with the standards set forth in Knoll v. White?
I'm not an expert on Knoll v. White, but we can certainly look into that for you.
I am not sure at this point. I mean, we do have a number of payments that were now due to health and safety reasons. I'm not familiar with the lawsuit.
It's a very big case, very big case. Were there any HH programs that were not paid during the budget impasse?
There were several county-funded programs that were not paid during the impasse.
And would they meet the criteria of Knoll v. White?
Again, I'm not familiar with it. I would have to check with our legal counsel on that.
Okay. The governor repeatedly said compromise budget. Is he referring to the framework budget or a supplemental plan he pushed forward?
It's my understanding when he refers to the compromise budget, it's the $30.8 billion budget that was almost passed just around Christmas time.
All right. So he wants to go back to that, but his supplemental appropriations do not meet that framework budget. So I'm very confused as to what he's exactly asking for, because the actual supplementals he is asking for that highlights in his budget request for supplementals do not match up with the framework budget. So, do you have any clarification on that?
I mean, if you have a specific question about a line item, I think we can try to help, but I'm not sure there was
The entire thing, I mean, he's literally asking for $50 million more in his supplementals than, quote unquote, the framework budget. So,
I would think for a lot of our appropriations as well, we continually update the model for the program, taking a look at the actual program. So what we may have calculated for supplementals for 15-16 as part of the budget request is a more up-to-date calculation. So the supplementals that we include as part of our budget request are an updated supplemental compared to what the governor may have had in the framework budget.
okay. And one last question. You mentioned that the minimum wage executive order was not expansive and will not cover you.
No, I said it wouldn't cover a great deal of my department. I didn't say it wouldn't cover me.
All right. So I would like you to take a look at specifically under coverage B, employees who directly perform services or construction. That is an or statement and literally covers definition of employee in minimum wage act includes any individual employed by an employer as long as they're not exempted by the minimum wage act. That line covers private sector, public sector, anyone who directly performs the services. Under your specific department, you have a lot of entities that directly perform services. Nonprofits, I'm not sure, are covered under that generally, but you do have some. So I would take a very, very strong look at that and maybe ask the governor to revise that language so it's not the expansive nature the language says as to what he actually enacts. So thank you, Mr. Chairman.